Polycystic ovary syndrome, or PCOS, is a complex condition that affects hormones, metabolism, and fertility. One supplement that has gained a lot of attention in recent years is inositol, especially myo-inositol. While it can be helpful for some patients, it is not a perfect solution. Let's get into the 3 benefits and the 4 limitations of using inositol for PCOS. Hi. My name is Dr. Basma Faris, and I'm a board-certified OB-GYN and nutritionist who specializes in PCOS. So one of the major advantages of inositol is that it can be a helpful option for patients who cannot tolerate metformin. Metformin is a commonly prescribed medication for insulin resistance in PCOS, but many patients struggle with gastrointestinal side effects like nausea or diarrhea and abdominal discomfort. These side effects can limit adherence, especially in the first few weeks of treatment. Inositol, on the other hand, is generally much better tolerated. Most patients experience minimal to no gastrointestinal symptoms, making it easier to stay consistent long term. Because both inositol and metformin improve insulin sensitivity, though through slightly different mechanisms, inositol can serve as a reasonable alternative for people who cannot take metformin or who prefer not to. Another potential benefit is that inositol is often viewed as a more natural option. Myo-inositol is a compound that your body already produces and is also found in foods like fruits, beans, and whole grains. Because of this, many patients feel more comfortable starting with it compared to prescription medications. It works by improving insulin signaling and supporting ovarian function, including ovulation. For patients who are hesitant about medications or prefer a more lifestyle-oriented approach, inositol can feel like a more approachable starting point. That being said, natural does not always mean harmless or effective for that matter, so expectations still need to be grounded in evidence. A third advantage is that inositol is generally considered safe. Clinical studies show a strong safety profile with very few side effects reported. It does not typically cause hypoglycemia or low blood sugar and is well tolerated at the commonly studied doses. However, it is still important to emphasize that patients should always check with their doctor before starting it. Inositol can interact with other medications or supplements, and dosing may need to be adjusted based on individual health characteristics or conditions. This is especially important in patients who are pregnant, trying to conceive, or taking other metabolic or hormonal medications. Despite these benefits, there are also 4 meaningful limitations to consider. One key drawback is that the data, while promising, is still somewhat limited, somewhat early. There are multiple randomized trials and meta-analyses suggesting that inositol improves insulin resistance, lowers testosterone levels, and supports ovulation. However, compared to medications like metformin or ovulation induction agents, the evidence base is a little smaller and less standardized. Not all studies use the same formulations, ratios, or patient populations, which makes it harder to draw firm conclusions. While many clinicians, including me, use inositol in practice, it is still could be considered option in guidelines rather than a first-line strongly recommended therapy. A second and very important downside is that inositol doesn't replace lifestyle changes. This is one of the biggest misconceptions. Lifestyle interventions, especially nutrition, weight management, and exercise, remain the most effective foundation for managing PCOS. These changes directly improve insulin resistance, reduce inflammation, and help regulate hormones. Inositol can support these processes, but it does not eliminate the need for them. Patients who rely only on supplements without addressing diet and physical activity are unlikely to see meaningful or sustained improvement. The best outcomes happen when inositol is used as part of a broader, structured treatment plan. Lastly, the supplement industry itself is a concern. Unlike prescription medications, supplements are not tightly regulated. This means there can be variability in purity, potency, and quality between brands. The most commonly studied dose of myo-inositol is 2 grams taken twice daily for a total of 4 grams per day. It is often combined with D-chiro-inositol in a ratio of 40:1 to better reflect physiologic levels. However, many supplements on the market do not clearly follow this ratio or provide transparent labeling. Some products contain subtherapeutic doses, while others use non-standard combinations that have not been well studied. This variability makes it difficult for patients to know what they are actually taking, and it can lead to inconsistent results. Some products may not contain the labeled amount of inositol, while others may include unnecessary additives or other ingredients. Choosing a reputable, third-party tested brand is very important, but even then, consistency across the market is not guaranteed. This lack of regulation adds another layer of uncertainty when recommending inositol to patients. Inositol is a useful tool in the management of PCOS, but it is not a cure. It can be especially helpful for patients who cannot tolerate metformin, those looking for a more natural approach, and those who want a generally safe option with a low side effect profile. At the same time, its limitations such as variable evidence, dosing inconsistencies, and the need for continued lifestyle changes and supplement quality concerns should not be overlooked. The most effective approach is individualized care with guidance from your doctor. If you're in New York State or any of the 12 states that I am licensed in and would like to schedule a telehealth visit with me, you can check out the links in the description. Remember to hit like and subscribe, and I'll see you in the next video.